Welcome to the next segment of our series on the basics of team-based care. This program is brought to you by the Regional Chronic Disease Collaborative members of Alaska, Hawaii, Montana, and Wyoming. In this segment, we will review the definition of terms and define the core concepts associated with team-based care that are included in this learning series. The Institute of Medicine defines healthcare teams as two or more healthcare professionals who work collaboratively with patients and their caregivers to accomplish shared goals. Teamwork is work done by a group acting together so that each member contributes to the efficiency of the whole. Patient-centered care, sometimes called person-centered care, is guided and informed by each individual patient's goals, preferences, and values. It includes the patient in their own healthcare planning and decision-making. Whole-person care recognizes the interconnectedness of physical, mental, emotional, and social well-being. Access is the ability of individuals to obtain and use health services, information, and resources. In between visit care and activities are the tasks that take place outside of the clinical setting, in between scheduled appointments. Examples may include care coordination or remote patient monitoring. Health outcomes are the measurable results attributed to an intervention on a person's life. Health equity is when each person has the chance to reach their full health potential. Social determinants of health are the non-medical factors that influence health outcomes. They may occur based on where people are born, grow, work, live, and age. They include a wider set of forces and systems shaping daily life. Health-related social needs refers to the social and economic needs that we may experience that affect our ability to maintain our health and well-being. They are a result of our community's underlying social determinants of health. Performance or evaluation measures are used to assess the effectiveness of projects, programs, or the delivery of services. As part of our team-based care model, we will establish performance measures that will help confirm the changes we make have the impact we hoped for. Fee-for-service is a healthcare model where providers are paid for each service or procedure they perform. Value-based payments tie payment amounts for services provided to patients to the results that are delivered, such as quality, equity, and cost of care. Capitation is a payment model where a provider is paid a fixed amount per patient per period of time to cover the cost of their healthcare services. In this learning series, sustainability is defined as addressing the financial ability of a healthcare organization to generate enough revenue to cover costs, invest in resources and staff, and continue to provide quality care to their patients. Return on investment shows how much value you get back for each dollar or the effort spent on something. It can be as basic as dollars out versus dollars in. In healthcare, ROI might also be measured as medical costs avoided, reduced absenteeism, improved health outcomes or access to care, increased engagement, or positive experiences, among others. Health information technology is the application of information processing, both hardware and software that deals with the storage, retrieval, sharing, and use of healthcare information. An electronic health record is an electronic version of a patient's medical history that is maintained by the provider or health system over time. Quality improvement is a framework to help systematically improve the way care is delivered. It includes continuous efforts to achieve stable and predictable results to improve processes and outcomes. Change management is a structured process that provides guidance through a transition or change in an organization using planning and implementation tools while actively managing the human aspects of change. Now, let's move on to the core concepts of team-based care that we will use throughout the series. The guiding principles include putting the patient first, building a team culture within our organization, empowering our staff to work at the top of their licensure and skill set, and to be proactive in finding ways to help care for our patients. Encouraging critical thinking in all our team members so they continually look for ways to anticipate the needs of both patients and other team members and proactively work to meet these needs. And knowing our population, which will help our team focus on what is needed most for our patients and community. The key elements of team-based care typically include shared patient-centered goals and care plans, effective communication and coordination of care support, advanced use of evidence-based guidelines by team members, enhanced patient engagement and self-management, regular care team meetings and other structures to communicate and to follow up and monitor patients' progress, and tracking performance measures to confirm we have the outcomes and results we expect. Core concepts of team-based care include planned care principles, such as obtaining pre-visit labs and advanced access. These are necessary to deliver effective and efficient team-based care. In addition to usual rooming, enhanced processes may include patient functional status and behavioral health screening, social determinants of health screening, agenda setting, medication reconciliation, and beginning documentation. Co-location is when the core team works together in a space that allows for ongoing and continuous communication between the team members. This is essential for effective team functioning and ongoing communication. Daily huddles are brief daily check-ins with all the core team members to review the day's schedule. By allowing the team to anticipate the needs of the day's patients, we can improve the efficiency of the workday. Daily huddles can also emphasize the availability of all necessary records, allow for the review of options for add-on appointments or procedures, and help build team culture. Regular meetings of the core team and the extended care team typically occur on a weekly or bi-weekly basis. This allows for communication between all team members involved in the care of patients with complex care needs, as well as focused discussion on the care gaps of all patients, resulting in coordinated, effective care. Warm handoffs are verbal communication about the patient between team members, often in the presence of the patient. This enhances the patient's engagement in their own care and demonstrates a united care team and effective communication between team members regarding the patient's ongoing needs. Using tools such as standard messaging, standard smart sets, and templates leads to consistent and accurate communication and health record documentation in the electronic health record software. This standardization decreases the chance for errors and improves the quality of the patient record. The extended care team members, including case or care managers, clinical pharmacists, diabetes, or other lifestyle or disease-specific educators, among others, play a key role in helping to care for our highest risk and most complex patients. Using members of this team whenever appropriate greatly enhances the care of these patients, leading to improved health outcomes. There are many patient needs that arise at times other than their office visit. These are in-between visit activities and include things like test result follow-ups, triage issues, addressing patient questions, refills or forms, and identifying and addressing care gap issues. Not all care teams look alike, and each care team will be unique to its setting and situation. These guiding principles can help build a solid team culture for our practice. The team works to establish shared goals that reflect the patient and practice priorities and can be clearly articulated, understood, and supported by all team members. There are clear expectations for all team members' functions and responsibilities. Team members earn each other's trust, creating greater opportunities for shared achievement. The team prioritizes and continuously refines its communication skills. The team agrees on and implements reliable and timely feedback on successes and failures in both the functioning of the team and the achievement of the team's goals. These are used to track and improve performance. In the next segment, we will discuss how to design a team-based care model that will best fit the goals of our patients, practice, and community. Thank you for joining us.